just going back to when my manager told me that there weren't going to be any opportunities, that changed very quickly. And so from the time that she said that and the time that I got this new position, she left. Two of our other community outreach workers left, and also our health education specialist in that short period of time. So I went from being the intern who knew absolutely nothing to being one of the very few people in the program, because we were a small program to begin with, but I became one of the few people who actually knew everything about the program. And so that just put me in a position for when they replaced my previous manager and they hired a new manager, for me to really be able to advocate for myself and show her, and also tell her, but also demonstrate why I would be such a good fit for the role. So after several discussions with her, I think she was pretty sold on the idea of me being promoted to health education specialist, and she did just that. She promoted me.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 95. Hi everyone, Omari Richards here. Thank you all so much for joining. Be sure to follow me on Instagram if you have not as yet at the PH Millennial. Be sure to subscribe to the show on whatever platform you're listening to, as well as share it with a friend and leave a 5-star review. That definitely helps the show get out to more people, let them know how they can navigate their public health career. And once again, we have a great story today with some great insights. There's a little bit of background noise, but it doesn't take away from all the great things that were shared and the great insights that I think you all will find valuable in your career, as well as learning a little bit more about the community benefit side, which I thought was interesting because it's not something typically that we think about in public health, but it is public health and it's a niche in public health. But yeah, I enjoyed today's story and I hope you all will do too. Peace. Today, we have someone who believes every lived experience directly or indirectly influences a person's health, and that each person has the responsibility to contribute to health equity. She got a bachelor's in public health at the University of South Florida, then went on to get a master's degree in public health education and promotion at the University of Southern Mississippi. She currently works as the program coordinator for the HPV Cancer Prevention Program at St. Jude Children's Research Hospital. We have Neely, MPH, CHES. Welcome to the show.
Thank you so much. Thank you for having me.
Truly is my pleasure. Love connecting with the public health people. I was on LinkedIn just looking through people and your profile came up and I was like, okay, I could definitely reach out and see if you got some insights to share. So I'm glad to have you on this show.
Absolutely.
So tell me, how are you doing, and then how you been coping during this pandemic?
Overall, pretty good. So I think a lot of us tried to find ways to fill our time when the pandemic started. And so truly, I stay very busy, especially because I am in a new city, in a relatively new job. So that keeps me really busy. But I do try to find balance in that with just like some personal coping mechanisms. I like to spend a lot of time with my family. When I have time and energy, I like to read books, and that keeps me pretty balanced. But that's overall how I cope.
Okay, awesome. I'm guessing that we might dive into some of that, maybe not so much, but yeah, that's awesome that you're in a new city, in a new role as well. Probably very exciting and learning a lot of new things. And I think just like being in a new city is exciting as well as a little bit scary, but we know how that goes. Especially during a pandemic too, you know. Yeah. So tell me, how do you identify, and tell us a little bit about your personal background?
Sure. So my pronouns are she, her. Originally, I'm from Tupelo, Mississippi, which is a very, very small town. I spent a lot of my time living in Florida. So I grew a lot when I was in Florida as a person and also professionally. And I think that's essentially it.
Okay, awesome. Well, thank you for sharing that. And where are you located right now?
Now I'm in Memphis, Tennessee.
Okay, awesome. I was in Memphis. No, I wasn't in Memphis. I was in Chattanooga a couple months back. Yeah, I got to get across to Memphis for sure.
Yes.
Okay, so before we hop into your story, tell me, what does public health mean to you?
I think public health means a lot to me, especially, like I said, since I'm from a relatively small town, you don't really learn that much about public health or health issues in general, unless it's, whispers of someone, of them talking about someone who is sick or in the hospital. So essentially, the only thing that you learn about public health is that that's something that you don't want to happen to you. And the first time that you're hearing about it is when someone's being hospitalized, or unfortunately, if they've passed away, then that's when you learn a lot about different disease states.
Yeah, absolutely, absolutely. And I'm going to ask you a question more about that, but I'll ask it after I ask this question. So
Okay.
in your intro, I read out that each person has a responsibility to contribute to health equity, and that was taken directly, I think, from your LinkedIn page. Do you want to talk a little bit more about that?
Sure. So again, when I moved to Florida, I dove a lot into health equity and also health disparities. It was something that was really interesting just because it's not something that I learned about where I'm from, not explicitly anyway. And so when you really start to learn a lot about health disparities and health equity, what you learn is that a lot of the situations around the state of our society were intentional or purposeful, right? So we watched a lot of these things happen. And so now we're at the point where we sat back, we took a back seat, and we watched a lot of these things happen. But now I'm all about accountability. We watch these things happen, and now we have to deal with the consequences of the health disparities that have risen from that, and also the public health needs that have risen from that. So we, at least at the bare minimum, have the responsibility to acknowledge that, right? So that's what I mean by every person has a responsibility. Your responsibility is to acknowledge the things that have happened and to kind of forge a path forward from that.
Absolutely, and I love that a lot. And I do think, and I agree with that, probably everything you just said. And yeah, the systems have been set up intentionally to oppress people and to keep people back. And a lot of people don't realize that until very late in their life. And I think like public health has a big place in playing health equity and ensuring that everyone has access to health equity and just access to opportunities to improve their health. So yeah, I appreciate you sharing that. So just previously, you said that you didn't know what public health was, but then you got a bachelor's degree in public health from University of South Florida. So what was that process for you learning about public health?
Yeah, so I actually started and did a lot of my general coursework at the University of Southern Mississippi before transferring to the University of South Florida. And so when I moved to Florida, that was my first time realizing, and this is going to sound so silly, but realizing how many different types of people there are. And I don't want to oversimplify it, but in Mississippi growing up, the only people that I really saw were white or Black, or at least that's how I categorized them in my head. So when I moved to Florida, of course, there were both of those categories still, but then there were additional, racial and ethnic groups, but then even more subgroups within all of those. And so just the immense variations of people was overwhelming for me. So meeting different people, to me, they might look Black, but when I talk to them, they're like, I'm not Black, I'm Haitian. I'm like, oh, okay. Never met someone from Haiti before, so this is a new experience for me. But that was like the first step to what I now recognize as something that was really important to my public health career, especially as I started to work in community outreach and work within some of these subgroups, really understanding their culture and the differences in the differences in the different cultures. That was really important to acknowledge for them and also for me and the content that I was trying to share with them. But I don't want to get off on a tangent about that. I'll just say that at the time that I moved to Florida, that was really when I was getting into my public health coursework. And that's also the same time that I started working at Moffitt Cancer Center. So I really identify that as the start of my public health career. Even though when I started working at Moffitt, I didn't work in public health, I actually worked in the cafeteria, which most people would be embarrassed to say, but that was actually really impactful for me.
Awesome, awesome. Well, I appreciate you sharing that. And yeah, that I definitely think that like you being able to find your path and just understanding, because I think it's so important, just exposure. And as you said, you grew up in somewhere where like everyone you categorize as white and black, and you didn't get to see like a variation of blackness or a variation of people coming from different places. And that was something that's pivotal to your leading and your understanding. Um, so what you said that you were doing general classes when you were at the University of Southern Mississippi. Did you always have the thought in your mind that you were going to transfer degrees, or did you know, or did you have a thought of like what you wanted to do at that point in time doing the general classes?
No, I can also say that growing up in the South, parents have a certain expectation for you. So their idea of success is a lot different than what I now consider to be my idea of success. So when they sent me off to school, they envisioned me being a doctor or a lawyer, but at the bare minimum, a nurse. So that is what they sent me off to do. And I was totally bought into the idea of that. And I wanted to do it. And I don't know if I wanted to do it because it was truly something that I wanted or because it was an expectation of me. And so when I actually started to study and also just talk to my peers, I didn't realize how many options there were. I had gone to college with such limited knowledge and this just one expectation that I didn't realize how broad the opportunities were. So I took one class, which is essentially Introduction to Public Health, before I ever changed my major to public health, and I loved it. I did so well in that class, and actually better than I had done in any of my classes. And so it was something that really it pushed me to want to learn more about public health. And so I changed my major to public health before I ever left the University of Southern Mississippi, but I didn't take any additional public health classes there. So I didn't really launch into that until I transferred my degree. And I really did that because my mom lived in Florida at the time, and she's someone that's super important to me. So I just decided one day I just woke up and I was like, I want to move to Florida with my mom. And that's what I did. I really just packed up all of my stuff and I moved to Florida and I enrolled in the University of South Florida.
Okay, awesome. How difficult or what was that learning experience for you going from this place where you're saying that you're seeing like two types of people generally or in your mind to understanding that there's just so many different cultures out there? What was that experience like for you?
It was very overwhelming because, you know, it was a learning curve for me and I went through a real adjustment period. So one of the perfect examples of that is when I worked at Moffitt in the cafeteria, I worked with so many different kinds of people. So embarrassingly, there was a lady that worked there who she loved me. Like we talked every day. She helped me learn so much about the job. I always had the assumption that she was Hispanic. And so one day there was a customer in the cafeteria who was speaking Spanish and they needed help and I couldn't help them because I don't speak Spanish. So the first person I thought of was this lady because I knew she would help me. And so I ran and got her and I brought her back and she was like, I don't speak Spanish. I'm from Ethiopia. And I was like, oh my gosh, that's so embarrassing. And then also people mistaking that I speak Spanish, which I don't speak Spanish fluently, but people would come up to me and speak Spanish to me. And I really didn't know what they were saying because I hadn't had that exposure before. And then vice versa, there were people who worked in the cafeteria with me who would try to instruct me and guide me. And I only understood like bits of what they were saying, or like sometimes none of what they were saying, but I would try to kind of like fake it till I made it. And one day, the one lady called me out completely. She was like, you have no idea what I just said, do you? And I was like, I don't. So it was that noticeable that I was really in culture shock and at times didn't know what was going on. And when you think about things like that, like if I had been there by myself, that would have been dangerous, right? Because I didn't have the life skills that I needed to really be successful in that environment. And I had to build up to that.
Okay, well, I appreciate you sharing that experience and just being transparent about how that operated for you and just reflecting on that experience. So how and I also appreciate you sharing that you worked in food services. Because I think that that's also important, because people could probably look at you now and say, okay, she's doing all these great things, and now, and they might be working in food services right now as well, and they could relate to that experience. So I really appreciate that. So what type of stuff did you do working in food services at Moffitt Cancer Center?
So I was told on the very first day that everyone starts in the dish room. So in the dish room, you scrub pots and pans, you clear patient trays, you clean garbage cans, whatever needs to be done in the dish room, that is exactly what you do. And if you work hard in the dish room, then eventually they will not promote you, but move you into different areas where you can learn different skills. So I moved from the dish room to making sandwiches and cutting cakes and pies. And then I moved from that to the entree line, where you actually serve patients and families, and also staff who come and get food from the cafeteria. And eventually I moved from that to actually doing patient tray delivery, which was a completely different experience for me, because I was going into the inpatient rooms and I was actually having direct communication with the patients and also with their families. And I think sometimes if I had just stayed in the cafeteria, if I had just stayed in the dish room, I wouldn't have seen any of that. And I would have had a totally different perspective of what cancer treatment actually looks like. But I got to see all of it. And so that was really interesting for me. And I still think about that sometimes, because that was one of the experiences that really taught me how to communicate with people. So I really value that experience.
Yeah, that is a great way to learn how to communicate with people, as well as I think the kind of grit that you have to get from having to wash dishes and do everything that needs to be done to really build on those skill sets to do like more specialized type of work. And I think that in itself, I think, probably just helped you to become a better professional and develop you as a person as well. So shout out to you for going through those experiences, and then to where you are to this day.
And shout out to the dish room.
Oh yeah, hell yeah. And then I think you shifted into a patient services specialist position at Moffitt Cancer Center after this. So tell me about that shift.
Yeah, so I did. I had the opportunity to essentially transfer into a different department where I was a patient service specialist, which is patient scheduling. So there are multiple parts to patient scheduling, but I worked in registration. So I was one of the first people that a patient would see when they came into our outpatient center. And so that meant that I was collecting all of their demographic information, insurance information, and things like that on their first visit. And then after that first visit, I was also the person checking to make sure that their information was up to date for all of those subsequent visits, and just helping to facilitate between check-in and making sure that they actually get to where they need to be for their appointment. So again, that was just a continuation of how I learned to communicate with patients before I ever got into community outreach.
Okay, and I'm glad that you're like highlighting this point, that you're learning something that's also transferable into the work that you're currently doing, because I think that that's important. A lot of people aren't able to make those parallels a lot of the time, but I'm glad that you're sharing that. Okay, so while you're doing these, you're also completing your bachelor's in public health. What was your view for what you were going to do afterwards, doing this work as well as getting your bachelor's in public health?
So I think it's funny that once I left after I left food services and I got out of the dish room and I got into patient service specialist, I loved that job. Like, I loved interacting with the patients every day, and I really saw myself being there like forever. The only problem with that is that I didn't make enough money to support myself long term. And so I knew that even though that was something that I loved and something that I probably could apply parts of what I was learning in my degree to, I knew that that wasn't like my final destination. And so I worked there all the way up until I graduated with my undergraduate degree, and even a couple of months after that. And that's when I really just had the understanding that I needed to learn more about public health. I needed to do more. And so that's when I actually went and pursued my master's degree in public health.
Okay. So you got your master's degree in public health at the University of Southern Mississippi. So tell me more about that thought process. You said that you graduated and you're working for a little bit, but you said that this is not going to be sustainable for the life that you want. So tell me a little bit more about that.
Yeah. So let me just throw in that I remember exactly how much I was making in that role, and it was $11.50 per hour. So if you want to equate that to something, that's not even a combo meal at most restaurants. So obviously there was a push for me to do more in advance in my career. And I think part of the shift from Florida back to Mississippi was just again what we talked about, how overwhelmed I was with the immersive experience of learning so much about so many different people at one time, and just overwhelmed with navigating my school and career opportunities to where Mississippi just seemed more like my comfort zone at the time. I had been there before. I knew some of the instructors. I knew what it was going to be like there. So that's why I chose to go back there and pursue my master's degree. And it actually ended up being a really good experience for me. So again, my focus was in health education. And so I entered into a cohort of about 5 people. It was super small, but it allowed us to get very close and to really help each other through that process, because the coursework was very grueling. And I joke with my colleague all the time that we kind of dragged each other through the program, kicking and screaming, but we made it out to the other side. But I don't think I would have made it through that if I hadn't had the opportunity to really get to know those that I was studying with.
Yeah, and I think that's an important like reflection as well. I think a lot of us think we need to go to these big schools or have these big classes, but a lot of time there's a lot of value in having a small class and having a small cohort where you're able to have that accountability and just a very shared experience with a very tight-knit group of people, which is also great. So why did you decide to pursue the concentration of health education and promotion?
I actually got that advice when I was a part of the Public Health Student Association at the University of South Florida. And so we had this very informal discussion after one of our meetings. And we were really just talking about the benefits of each of the concentrations. And so the president of the Public Health Student Association at the time said, if you just study health education broadly, then you open yourself up to more opportunities. Whereas if you focus on something very specific like maternal and child health, then most of your opportunities are going to be targeted there. But if you study health education, you can always go that route if you decide to do that and get that specialized experience, maybe not specialized education, but specialized experience in maternal and child health, if that's what you're truly interested in. The same thing with like cancer prevention, because I more broadly studied health education, I could apply those concepts to anything, including community outreach and cancer prevention, which is what I ultimately ended up doing.
Yeah, I like that a lot, and yeah, I definitely think, especially like if you know you're not gonna go specific into like maternal and child health, as you said, it's better to go broad, especially in a field with public health. If you're unsure what you want to do afterwards, it just gives you more width to choose and scope out what kind of opportunities you are able to make for yourself going into the future.
And I think I might have been a little bit uncertain about the path that I wanted to take, but I was leaning toward maternal and child health. And even after I finished my master's degree, I really thought that that's where I wanted to work. But that's not the opportunity that presented itself to me. And so cancer prevention was, and that just happened to be something that stuck. So sometimes you think you want something, but something else ends up working better for you.
Yeah, and I think just having that open mind to know that like sometimes opportunities just don't line up. Like you want to do the same type of work, but people are in these jobs and they're not going to come out of them for the same period of time. So there's just no opportunities there, as opposed to what you said, you wanted to do maternal and child health, but you were happy to go into what you did afterwards. So before we go on to what you did after you graduated from your MPH, were there any other takeaways that you had throughout?
Well, I guess we'll kind of lead into this, and I have said this a couple of times already, but the way that I kind of, and I hate to use this term, but it is what I did, but the way that I got my foot in at Moffitt and the work that I put in while I was there, most people would overlook those experiences, but those were really like the foundation of my public health career. The work that I put in there is what created every subsequent opportunity for me. So if you're in a job right now and you don't think that there's value in it, I promise there is value in it somewhere. It's all in how you apply that experience. So yeah, that's my takeaway.
Well, yeah, I appreciate you sharing that. And I think that is some important takeaways and just insights for other people to know about and to consider when they are going through their public health career. So you got your job after you graduated as a community outreach worker at Moffitt Cancer Center. So how exactly did you put your foot in the door to get this role?
So it was actually a little bit challenging because like you said a few moments ago, there are people, or at the time, there were people in these roles who had been in these roles for a really long time and they had no intention of giving these roles up. But who would want to? When you start working in public health, you love it and you want to continue working in public health. So that would totally make sense. But so like when I got toward the end of my MPH journey, I was then naturally looking for an internship to complete my degree requirements. And although Mississippi had been my comfort zone that entire time, I also was not naive about the fact that there were not that many public health opportunities in Mississippi, although there should be. Mississippi of all places, there definitely should be more public health opportunities, but at the time, this was 2016 or so, so there weren't. And so I knew exactly where I could go, and my comfort zone in my career had become Moffitt. So I started to kind of do some research, and I remembered that there was an outreach program at Moffitt because I had volunteered with them when I was working as a patient service specialist. I only volunteered once or twice. So they had an event that they hosted annually that was called the Men's Health Forum. And I realized that it was coming up and I had volunteered before. So I kind of weaseled my way in and emailed the contact and was like, hey, the Men's Health Forum is coming up. Can I volunteer? And also, are there any other volunteer opportunities or internship opportunities? And they were like, well, yeah, you can definitely come and volunteer for the Men's Health Forum and we could talk more about the internship. They didn't have a formal application process for internships. So it really was just that personal connection. And I did that thing that I'm sure people hate, but I went back and found the email from like years ago when I had volunteered with their program. And I responded to that email just so that they could remember who I was. And so that's what initiated that entire conversation. And so I ended up going back to Moffitt as an intern. And so I remember the first week of my internship, there was a health fair, and I went with my then manager to the health fair. And, you know, when there are downtimes and it's kind of slow, you kind of just talk amongst yourselves. And so she asked me what my plans were after I finished my internship. And I was very casually like, I'm going to stay. Like, I'm going to stay here. And she just laughed and she was like, well, we don't have any openings. There's really not going to be the opportunity for you to stay. And I was laughing too, because I was like, oh, I'm going to stay. You just don't know it yet, but I'm staying here. And so she was like, oh, well, I recommend this organization. You can look into those. And I'm like, I will. And so I spent a few months there as an intern. And around that time, they had an opportunity with one of the local malls there. And the mall essentially contracted them a space where they could do a pop-up location for outreach and education. And so I was really helping my manager to facilitate the opening of that space. And so there was a lot of work that went into that. But once it was open, they realized that they didn't have enough outreach staff to be able to man the location. So an opportunity organically came up where they were like, okay, Julia, you can stay if you would like to. And I was like, I told you I was gonna stay. So I accepted that position, which was community outreach worker, and it was a temporary position. I still didn't make a lot in that position. I think I made like almost $14 an hour, which wasn't a ton for someone coming out of a master's program. But again, I knew it was like a stepping stone for me, something for me to be able to build my experience and really put in the work that I needed to do to advance my career. So I did take that position, and the rest is kind of history, I guess.
Okay. Well, that's really awesome. I like your positive thinking and saying I'm gonna get a position. And even when people are saying like, no, it's probably not gonna happen, let me show you these other organizations, you're still adamant about it. I think that kind of mindset is also important, and probably like kind of helped in creating this organic position that came out there for you to do that work. So what kind of work did you do as a community outreach worker? Was it like attending events and fairs and things like that? Or you can tell me more.
Yeah, so we did a lot of health fairs. Actually, I spent a lot of time at the mall, just in our pop-up location, but on the weekends, I would do health fairs. Or if we had presentations at local churches or organizations, I would do those on the weekends or during the evenings. So our responsibility really was to go out and do presentations on cancers that are considered to be preventable. And by preventable, we meant that there were routine screening recommendations in place. So for us, those were like breast cancer, cervical, colorectal, prostate, lung cancer, things like that. But not just to go out to do presentations, but also to help to identify people who might need extra help navigating the health system, because we did have voucher programs for most of the cancer screenings that we did education on. So we wanted to also identify people who might be eligible for our voucher program so that they could come in and have those screenings at Moffitt.
Okay, that makes a lot of sense. And thank you for sharing that. So after this, or like during this, you said, I think you got promoted into another position, or was it a shift into another position? I have here that you are a health education specialist. So tell me a little bit about that change.
Yes, so again, I got promoted, and it was funny because just going back to when my manager told me that there weren't going to be any opportunities, that changed very quickly. And so from the time that she said that and the time that I got this new position, she left. Two of our other community outreach workers left, and also our health education specialist in that short period of time. So I went from being the intern who knew absolutely nothing to being one of the very few people in the program, because we were a small program to begin with. But I became one of the few people who actually knew everything about the program. And so that just put me in a position for when they replaced my previous manager and they hired a new manager, for me to really be able to advocate for myself and show her, and also will tell her, but also demonstrate why I would be such a good fit for the role. So after several discussions with her, I think she was pretty sold on the idea of me being promoted to health education specialist, and she did just that. She promoted me. And so I went from being responsible for giving the presentations. I went to actually being responsible for giving and developing our program content. So at that point, I did a total deep dive into our programming, and it was good. Our programming was always very good. But when I looked at our PowerPoint slides and the information that we were using in the community, it was very heavy. So it was text heavy. The pictures were not the best to relate to the audience that we were trying to reach. And I also wanted to do more work to target our programs a little bit better, because we were Moffitt, which Moffitt is very important in Florida as a NCI designated cancer center. So of course we had no lack of invitations. People wanted us to come all the time. And we would go because we wanted to be accountable to the community. But in that, we were going everywhere. Like, we weren't really targeting our programming or our resources where they could potentially go. So for example, if we're giving a presentation on cervical cancer, we probably don't want to be in a community center talking to 80-year-old men. That just doesn't make sense in terms of our programming. The same for prostate cancer. We don't necessarily want to be talking to 21-year-old sororities. So we just had to think a little bit, and those are silly examples. That's not what we were doing. But just to give you an idea of how it could be better targeted, we wanted to reach populations that were within those screening ages or had influence over people who were within those screening ages. So I did a lot of work with that to just revamp our content that we were bringing to the community.
Okay, and that's awesome. And I think you highlighted the importance of institutional knowledge and knowing more about the organization and how things run, especially when other people leave, just made you more senior, or just understand the back end stuff that a new person coming in can really get a lot of value from you. And it seemed like you put your foot forward to say that, okay, this is the things that I want to do. And the new manager recognized that and gave you a little bit more responsibility to take on that kind of work. You said that Moffitt is an NCI designated cancer center. What does that mean?
It's a National Cancer Institute designation. It just means that it's one of the cancer centers that provides very top tier care, and they make sure that happens. So being an NCI NCI designated cancer center, you have checks and balances in place to make sure that you're providing quality care.
Okay, so more like an accountability structure that they have, probably audits and different things like that.
Absolutely.
Okay. Awesome. Okay, so after you increased your role and became a health education specialist, you moved on to community outreach coordinator at Bay Care Health Systems. So how did you come across this position?
Yeah, so it was actually, I saw a posting for a role that was community outreach coordinator, but then when I read the description, it was different from any public health position that I had seen previously. And I had gotten to a point where I still very much loved Moffitt and the work that I was doing at Moffitt, and truly I could have stayed there forever. But I wanted to, again, learn more. I consider myself to be a lifetime learner, and I want to constantly build and sharpen those skills that I'm learning. And I saw this as an opportunity to just grow more. And so I pursued the opportunity, and I was hired on as the community outreach coordinator. And so essentially, I was a county-specific coordinator who was involved in the community health needs assessment process for all of our hospitals that were within Pinellas County, Florida. And so once we do the community health needs assessment and we identify what the community feels to be the top needs of the county, we are then accountable. We are then accountable to the community to create an action plan, essentially, to address those issues that were identified through the community health needs assessment. And so we put together implementation plans for each of our focus areas, which at the time were behavioral health, access to healthcare, and then also there was one around access to healthy eating and also exercise, things like that.
Okay, that's awesome. And okay, so I'm still in Florida. And I think this was at the same time that you decided to get a community benefits specialist certification. Is that correct?
It is.
Okay, so
yeah.
So tell me why you're thinking about getting that, and then what you learned from the community benefits specialist certification.
So one, I will say that I decided to pursue this certification during the pandemic. So part of it was to fill a lot of time that I had on my hands. So not only was it a great time, but it was also a really good opportunity that aligned with the role that I was in at that time. So when people hear community outreach coordinator, they're like, oh, that's so simple, that's easy. All you have to do is go out and talk to people and connect with them. That's just part of it. So working in community benefit, which is the department that I was in, is way more advanced than that. So as a part of the Affordable Care Act, it was then mandatory that not-for-profit hospitals do community health needs assessments and create these implementation plans that we created. But part of that is because not-for-profit hospitals have a responsibility to the communities that they serve to give back in a meaningful way. So in that are very advanced reporting structures. So not only do we have to report all of our community outreach and engagement activities, we also have to report it in terms of hours that our team members spend doing that, and also dollars spent from our hospital doing that. And so collectively, you have to make sure that all of those things align. So you have to make sure that the outreach activities that we're doing make sense in terms of the manpower, the hours that we're using. And we also have to make sure that the dollars match up to the hours and also the activities. And so a lot of that was very advanced, and there's a lot of science and strategy behind that. And that's exactly what the community benefit specialist certificate teaches you. It takes you all the way from the beginning to the end of the entire process. And so that was essential for me in that role, because I wanted to grow and advance in the role that I was in.
So I'm guessing that it did help you grow and advance in the role.
It did. Okay. It did.
And it is also great that you highlight that this was like something new for you, like something that you haven't learned specifically throughout your public health training, but it was something that you saw as important to really being great in your role and just being successful in your role. So for this training certificate, was it that you're just leading the processes of it, or was it an actual like back end program that is also that you have to learn to use it to operate, or was this just like brute manpower type of thing?
I think that I could have done my role without getting that certificate, because there were other coordinators that worked within my department and they didn't necessarily go and get the certificate. But I didn't just want to be able to do the job. I wanted to be able to do the job well. And I felt like to do that, I really needed to understand the process. And that is what ultimately led me to do that.
Okay. That makes a lot of sense. And then also during the pandemic, you decided to get another certificate. So you got the Diversity, Equity, and Inclusion in the Workplace certificate at USF Corporate Training and Professional Education. So what was your thought process for wanting to do this? And then what did you learn from it?
Yeah, so I think that one specifically was just my desire to stay involved in diversity and inclusion, especially as it relates to public health. So I did that certificate program earlier last year in 2021. And it was in a time where I had just accepted my new role, and I hadn't gotten quite into the programming aspects that I'm in now in my role. And so I wasn't doing as much health education. I wasn't doing as much health equity type work at that specific time. And so that was really just to keep my skills fresh so that I didn't forget everything that I had learned from being in a super diverse environment in Florida to now Memphis, Tennessee. I just wanted to continue to learn and be able to apply those aspects.
Okay. Well, thank you for sharing that as well. And another question came up as I was thinking about that. So for the community benefit specialist certificate, you said that a lot of your coworkers didn't have that. How did you like learn that this was a certificate, or was something that you can do to like broaden your skill sets and learn more?
Yeah, so there is community benefit is kind of like a niche within public health. And there are a smaller group of people who are, just extreme experts in this specialty area. And so one of those experts just happened to be my manager at the time. So she was someone who knew a lot about community benefit and was super plugged in to all of the professional groups. And she was actually involved with designing the certificate program. And so when we would have like calls or conferences or any of those things, they would always mention the certificate program. And so it ended up being me and one other person in my department who took the initiative to actually complete the certificate program.
Okay, that makes sense. And yeah, I'm glad that you were able to like, just that your manager was able to show you that this was an opportunity that you could take, and then you were actually able to action on that and get some tangible takeaways that were helpful to the job and the role that you did. So you said that you left Florida and you moved to Memphis, Tennessee. and you became a program coordinator for HPV Cancer Prevention Program at St. Jude Children's Research Hospital. So what was the thought process behind this?
I will say that was a leap of faith, because if someone had told me that I would move from sunny Florida to super cold Memphis, Tennessee, I would not have believed them. I was like, what? I would have laughed at them the way my manager laughed at me when I was telling her I was going to stay during my internship. But I did think that, I grew up in Tupelo, which I mentioned earlier, Tupelo, Mississippi, which is just about an hour and a half south of Memphis, give or take. And so I had been to Memphis a ton of times before, and I had even had the opportunity to visit St. Jude as a child, because I had a childhood friend who had a childhood cancer and was being treated at St. Jude. So sometimes we would go there and we would visit her on the St. Jude campus. And so I think I also mentioned that there are not a ton of public health opportunities in Mississippi. So when you think about where you would go to start a career in public health, it might be Memphis, Tennessee, it might be Birmingham, Alabama, it might be Mobile, Alabama, but it's probably not going to be anywhere within Mississippi. And people get lucky. I'm not going to say that there aren't any opportunities, but for the number of people who study public health, there aren't enough opportunities for everyone. And so I always knew that if I were going to move back home, it would probably have to be to Memphis. And so if I were going to be back in Memphis, St. Jude would be my first choice to be. And so it just so happened that HPV was one of the topics that I educated people on when I worked at Moffitt in the Cancer Prevention Program. And even then, I was very interested in the topic. And I always thought it would be cool to focus more specifically on HPV. So when this opportunity came about, I was ecstatic. I was like, oh, this is the job and the opportunity for me.
Okay. And what about HPV exactly excited you? Granted that you also just did a lot of health education around it before.
What was super interesting to me is that I didn't get the sense when I was going into the community that people really understood it or knew that much about it. And even honestly, prior to working in public health, I didn't know what HPV was and I didn't know anything about it. So taking on that role and actually working in that program is what allowed me to develop the knowledge that I did have and was able to share with people about HPV. And so because HPV is so super common, most people are impacted by it one way or another, but then there are those people who have persistent HPV infections and can eventually develop an HPV cancer. And it's preventable because HPV can be prevented by a vaccine. And I don't know that people really know or understand that. And that's really I wanted to soak in everything about HPV and learn as much as I possibly could.
Okay, that makes a lot of sense, especially like you're saying that you're going into community, and I think even to this day HPV is something that people don't hear about enough, or they as you said, they just don't understand it. So you knowing that and wanting to make a change there is definitely impactful and meaningful, and definitely gives a role that a little bit more meaning, as well as it's a really great organization to work for. I'm guessing St. Jude Children's Hospital. So what do you do as a program coordinator for the HPV Cancer Prevention Program?
Sure. So it looks a little bit different than what my previous roles have looked like. So for one, the HPV Cancer Prevention Program at St. Jude is relatively new. And it's also more upstream than some of the things that we typically focus on at St. Jude. St. Jude is a wonderful organization. And there is a ton of work in clinical advancements and research advancements, but because we do not yet know how to prevent childhood cancers, there's not a ton of outreach work that can actually be done, or there is, but we have to get creative about it. And so that is where the opportunity came for the HPV Cancer Prevention Program, because although we cannot yet prevent the childhood cancers, we can promote the HPV vaccination within that target age group to hopefully prevent HPV cancers in adulthood. So in my work, I focus mainly on our outreach efforts in the states of Arkansas and Missouri. So that means working with some of the statewide cancer coalitions, the HPV task groups, the cervical cancer task groups, just to be a resource to the work that they're doing, not necessarily to replace any of their work, but to be more of a supportive structure. So for example, if an organization is doing a communications or an outreach campaign around HPV, then our program has the opportunity to come in and support as a collaborative partner in that. Or if they want to host an event, I can work with them as a part of the planning committee and help to create a really successful event. We also publish statements from time to time. We regularly submit posters and abstracts to some of the national conferences. So that's some of the work that I've been involved with so far.
Yeah, awesome. Well, thank you for sharing that. And that is awesome that you're able to do like more of the upstream work that is definitely necessary and is very, very public health. How has the transition for you been like? Because you've been in Florida for quite a bit after leaving Mississippi, and now you're in Tennessee. What's that transition like for you? Even though I'm granted that you are like a little bit closer to family now, but how is that like work wise, and I guess also personally been for you?
I like being in Memphis, especially the area that I'm in. It's very nice, but it's like being in a different world from being in Florida, and the weather is definitely different. So I think the first month that I was here, it was cold, but it was like cold in a way that I could bear it. But after that first month, there was this crazy like snow and ice storm. And I actually had gone down to Tupelo so that I could visit my dad, and I got stuck. I got snowed in after like a month of being here, and I felt like I was on like a Hallmark movie or something. But that was totally different from being in Florida. In Florida, you might have to worry about a hurricane or, lots of rain, flooding from time to time. But I have never been snowed in or stuck anywhere. And I don't remember it being like that, growing up in Tupelo. I don't remember the weather being so severe. So that's very different for me. And it's been something that has been hard to adjust to, because not only are the winters very, very cold, but the summers are extremely hot. So like when it gets to be summertime, I feel like I'm back in Florida, and it might actually be worse, because in Florida it gets hot, but at least you could go to the beach. Here, it just gets hot and you just have to walk around in it. So I think that has been a bit of an adjustment. And then also, there just are certain things that I had gotten used to as far as being in Florida that I don't have access to here. And it seems like something super silly to complain about, but like some of the stores that I was used to going to, I don't have access to here anymore. Whereas I could wake up in the morning and just go get a smoothie bowl. Can't necessarily just go get a smoothie bowl now. So again, super minor things to complain about, but it's all a part of just the adjustment. And in that I guess being in Florida, there are so many different populations to cater to that you can find almost anything that you're looking for. Because there is something in Florida for everyone. So here you come back and there's not as much diversity in the population. So the services that are available, the products and services that are available are based on the population of Memphis. And so of course, I could expect that it would be different, right?
Yeah, that makes sense. One thing you don't have to worry about in Memphis though is the alligators, that's for sure.
That's true. That's true. You're right. I'll take that into consideration because I have not yet seen an alligator. So I'll take that.
Yeah. But it is also crazy to think about like climate change and how that's affected weather everywhere, making weather more severe, like colder and then hotter and then more storms. harsher storms and all those different types of things. But yeah, I hope that you're able to really settle in more and enjoy the city, and hopefully you don't get snowed in anymore, or go in, I guess, the next year as well.
Yeah, and I guess I could say too that I've been super careful since I've been here. I probably haven't been able to explore as much as I typically would in a new city, just because we are still in a pandemic, and I understand that I have a certain responsibility as a public health professional, and also an additional responsibility just because of the population that we work with at St. Jude, that I know I can't expose myself to certain things and then show up at work every day. So I really do take that into consideration, and I try not to be as many places as I usually would.
Yeah, I think that's a compromise that a lot of us are having to make. Myself as well, moved to North Carolina during the pandemic, and it's been very interesting, especially as a public health professional. So we will see how that goes, but can't complain, can't complain.
We will have an opportunity at some point. So 5 years after being in a place, we'll be like, oh, you're gonna go explore North Carolina, and I'm now gonna go explore Tennessee. 5 years later, it's still gonna be new to us.
That is true. That is true. That is something good to look forward to, right?
Yep.
Okay. Awesome. Awesome. Well, before I move you on to the Furious Five section of the show, I wanted to ask you, where would you like to see yourself in the future?
I think that I would like to start preparing myself for like leadership positions, increasing responsibility, possibly management, just because I feel like I've learned a lot of really good skills as a program coordinator. And when I think about, and I don't think about it often where I would go next, but when I do think about where I would go next, I realize that I can't just continue to look for coordinator positions. I have to start to look at the next level. And so for me personally, I'm starting to think about what that next level means for me, and then how I prepare myself for that, education and experience wise.
Okay, that's awesome. And that's a good point of like self-reflection and self-awareness to really understand where you are, where you want to go, and finding the best way to get there. So I look forward to following along and seeing how that does go, and where you do end up in the near or not so near future. So you're most welcome. And then moving on to the last section, the Furious Five, 5 questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
So I think this would be the same experience that I have tried to give throughout this entire interview is don't discount any of your experiences. Use those to your advantage, and continue to highlight and build your skills through experiences that you might think are less impactful, because a lot of experiences do have transferable knowledge, and that's something that you can use for future positions.
Awesome, awesome. And then number two, if you were talking to someone wanting to get into your position, what advice would you give them?
The advice that I would probably give is you have to have a certain personality to do community outreach specifically, just because you can show up anywhere and you can share information with people. But if you are not able to connect with them on a level that allows them to really receive the information that it is that you're trying to share with them, you will not be impactful. So you could show up somewhere and give an amazing presentation, but afterwards, if people are coming up to you and they have questions for you and you're not able to make that connection, then they're probably not going to walk away from that presentation with anything. Also, probably the advice that I would give is that if you are pretty soft-spoken the way that I was before I started working in public health, you got to amp that up a notch. So you have to become more comfortable in your own skin and your own voice to really be able to advocate for public health and to reach the communities that you say you want to reach. And in that, you have to make connections with people who will be able to advance you in your career, people who will be able to open up opportunities for you, and don't burn your bridges, so that you can always go back to those opportunities. For me, I went back to Moffitt multiple times, and it was because I worked hard when I was there every single time, and I did not burn my connections with my managers or my peers. So that's super important as well. And then the last thing is to be open to feedback. So when you do something or you participate in something, for me, I just gave a presentation the other day. And even at the point where I am in my career, at the end of it, I always say, I'm open to feedback. Tell me what I did great. Tell me what I did wrong so that the next time I can do it even better.
Yeah, I really like that, especially the part on the feedback and the critical feedback. I think it's so important. That's something that's like very undervalued in people's just like development and better understanding how they can do better in the work that they're doing. So number 3, what's something you're working on improving in your life right now?
Something that I'm working on improving is finding balance. So I mentioned that I do want to take on additional leadership experiences. I want to kind of segue into management, but with that comes increasing responsibilities because I have to demonstrate that now before I ever have the opportunity to advance. And so for me, it's learning how to manage the taking on additional tasks. So how do you create that balance when you now have more work to do, but then you're also acting in a mentorship role for other people? How do you make time for that and make time to actually complete your task? And in addition to that, make time for yourself. So that's something that I have to think about daily. And I have never been a person to make lists or use Excel spreadsheets. That is not my personality. But now I find myself making myself a list every week and keeping track. I have to scratch off things as I complete them. And then also on a day-to-day basis to just keep up with my tasks, because I'm also thinking about pursuing an advanced level of education. So I have to factor that in as well. How do I create that balance for all of these things to coexist?
Okay, awesome. And on that vein, what's the thought process for you wanting to continue and get an advanced level education?
So I do think that there's always something to learn, especially in public health, because there continue to be advancements in just the science and the practice of public health. And so I want to be able to stay on top of that, but also I want to be able to be an asset to the organization that I work for now. So St. Jude is, again, a wonderful organization that a lot of people believe in. And we are primarily a donor-supported organization. So if there are people across the world who believe in the work that is happening at St. Jude and are willing to donate to us as an organization out of their own personal funds, I should be able to also want to be an asset to St. Jude and to be able to contribute to my organization in a really meaningful way. And also, if I do pursue higher education, it will be in public health leadership and practice. And so I think that kind of just aligns with where I say I want to go career-wise.
Yeah, definitely see a lot of alignment, and that makes sense. Thank you for sharing.
Sure.
Number 4, professionally,
Okay.
do you recommend anything?
Professionally, if you are pursuing health education, I do recommend that you try to become a certified health education specialist. It helps you stand out, I think, among other applicants who will want the same jobs that you want. But it's not just something on paper. If you have done the work and you do become a certified health education specialist or CHES, you're qualified. You've done the work and you have demonstrated that you are knowledgeable in all of these areas. And so it's also a way to keep you accountable to yourself in the work that you're doing, because you will have to do a certain number of continuing education credits to keep up with your certification. And so in that, you are making sure that you're continuing to do the work that supports the work that you will do as a professional. I also recommend that you seek out any additional training opportunities that might be specific to your field of work. If you are not great at professional speaking, but that's something that you will need to do, seek out Toastmasters or anything that will make you feel more confident in that ability. If you know that there's an opportunity where you will have to do more scientific writing, you might have to author a publication or something like that. If that's not your skill set, then do the work to build up to that skill set. Because again, it will make you stand out.
Yeah, that's some great advice there. And then number 5, last but not least, where can people connect with you?
So people can connect with me primarily on LinkedIn, where my name is Julia Neely, MPH, CHES. I am becoming more and more active on LinkedIn as I have more work to share. And so on my LinkedIn, I usually feature any of the most relevant things that I've been working on or any opportunities that my program might have to connect. We always do a ton of seminars, webinars. There's always an opportunity to be involved with us. So I share those things there.
Okay, awesome. And I'll be sure to link that in the description as well as the show notes for anyone that is interested in chatting with you, Julia. I definitely appreciate you coming on and taking your time to share your insights and about your story and your thought process throughout. Definitely was valuable. So thank you so much.
Absolutely. Thank you for having me.
My pleasure. Then some housekeeping items. Thanks for watching or listening to this, everyone. Definitely subscribe if you have not as yet. Definitely helps a lot. Be sure to like this if you're watching this on YouTube. Leave a review, hopefully a 5-star review, and let me know why you left a 5-star review. And be sure to share with a friend so that this story and other stories like it can get out and help other people navigate their public health career. And if you'd like to support, you can go to thephmillennial.com/support and find different ways to support there. Thank you all for tuning in. Peace.